Right, for more on the state of the Eastern Cape healthcare system, we're joined now by Section27 field researcher, Thokozile Mtsolongo. Thokozile, good to have you, and thank you very much for your time. In terms of assets that are being inherited by the incoming health MEC, Thokozile, what is she looking at? I mean, we're talking about the state of ambulances now, but I'm sure there's a merit issue when it comes to assets that currently belong to the health department that would need to be addressed.
Thank you very much for this opportunity. Indeed, when we are talking about some of these assets being the ambulances that are available within the possession of the Eastern Cape Department of Health to service the communities of this province, we are looking at ambulance vehicles that are actually quite thin to provide these services. So you have a context where the Eastern Cape is largely a rural province in its setup. And so that alone provides or just gives added difficulty in terms of how these services are provided, as well as just, the pace at which, these services are provided. So it then, even challenges the meaning in itself of emergency when it comes to the provisioning of emergency medical services, because of the context of the Eastern Cape. And so you're working with very little in terms of what is available on the ground, what is operational on the ground when it comes to ambulance vehicles. So that is what the new MEC is taking on as she steps into this position.
She sounds brimming with confidence in the short term, at least in terms of what she is faced with. But I mean, considering what her predecessor, MEC Meth, would have had to deal with, we know that this province has made the spotlight in some unfavorable terms in some instances for all the wrong reasons. For example, still on the issue of ambulances, it's that controversial scooter ambulance tender. How far has that particular matter gone in terms of accountability?
We actually are not aware of how far the department has taken that on to recover from that, to recover from the funds that were spent on those vehicles. A clear plan, or rather a transparency on what that whole plan looked like, and the funds that were spent against the vehicles that were purchased. It has in the past, across different platforms of discussions, raised eyebrows about whether the department truly has understood the platform that it is delivering these services against, because when you are faced, if you currently, as it stands, you have vehicles that are running on 4 wheels, right, in whatever form that these ambulances, that they come in, and they're running on 4 wheels, and the idea then, the crux of the matter then was that they were talking about a 2-wheeled form of vehicle that would allow for EMS workers to be able to reach the most unreachable spaces in these rural contexts especially. And, when one thinks about the road terrain that I mentioned earlier, and the fact that 4-wheeled vehicles cannot travel on those roads properly because some of these vehicles are not created, or rather they are not, they don't match the context within which they are working, especially in the rural context. We don't have enough of the kind of vehicles that we need in the rural context that can match that context. A scooter trying to get to an emergency, it has become very difficult to try and fathom what that kind of service would look like, and how a patient would be brought down from wherever to travel to an ambulance, if that was the kind of thinking behind it. Obviously, I imagine that it wouldn't take a person to a point of care, but it would try and reach a person or a patient or a client in an area where the actual vehicle itself would not be able to go. But the reality is that even those four-wheeled vehicles, in the current form that they come in, are struggling to get up to those areas. They are struggling to reach those areas, and the road terrain keeps being the factor, for getting those ambulances to those areas, amongst others, of course. But it keeps being one of the core factors that makes it so difficult for communities in those contexts to be serviced in the manner that they should be serviced.
So what do you expect to change, in this new administration? The MEC herself saying one of the key issues is to engage with stakeholders, particularly to look at the medical challenges or legal challenges that the department is facing versus the budget constraints that they are currently dealing with. What is the driver of those legal costs?
I should think that the driver of the legal costs are many, and they're varied across the different areas or levels of services being provided by the Department of Health. So you have instances where the department has faced legal battles where newborns have been born with some form of deficiency, or not deficiency, but some form of disability as a result of how a process of a woman giving birth has gone, right? Where there has been instances of negligence coming from the healthcare workers. We know that there have been, other instances where even once it doesn't matter what the age now, whether you're an adult as well, where you could have gone in for a procedure, even a simple procedure at that, and you come out of the hospital with maybe something else that has happened to you, something else that is another procedure that has been performed, or a procedure that has left you in a condition that when you came in, is far worse than when you came in, rather. So those are the kind of legal costs or legal claims that people have against the department, where there has been a show of a lot of negligence that has come from those kinds of cases. And so when you're looking at trying to balance the costs that have come against the department, which the department itself has confessed to, that they do face a lot of legal costs against them, and then a budget that has been declining, also against what is happening across, the availability of budgets to provinces and the declining status of those budgets. It then becomes even more difficult to then perform, the duties and provide the services that are required at this province in the manner that they are required, to see a gradual improvement, as we would like to see, of all the services that are provided by the Eastern Cape Department of Health. And so that is definitely a challenge that the new administration is going to be faced with when it comes to trying to prioritize what areas are more urgent than others, but also in terms of trying to make sure that none of the service areas within health will be, put in the back, in terms of being provided for, that all these service areas are actually going to receive adequate, adequate funding. But how do you do that when we already know that the department is really struggling to balance all of these services on the declining budget that it has been confronted with time and time again, really.
How does that then play out, for example, in the program to eradicate mud structures? I believe there remains mud clinics in the province, even with some effort being tried to eradicate that. Out of 13 health facilities in the province identified to have elements of mud structure, only 5, for example, would be included in the budget for 2023-2024, which means at least a good other 8 would still remain.
Yeah. So it again, it just, a thinning budget does have a big impact on what the department is able to do or what it is not able to do. And so when they have prioritized, when they make these prioritizations based on the information that is before them, it really just, it's a very tough balance to strike, because it's based on a balance of things such as the performance of the department over the years, as well as I said, the other demands upon, that budget, the available budget. So the performance, as we've seen, unfortunately, the department has had a number of instances where it has returned funds to the Department of Treasury for being unable to spend some of these funds. At the same time, then, as time goes, based on that kind of performance, we know that then departments tend to get a little bit less every single time they aren't able to show that they can spend those funds. And, there are various reasons behind why they aren't spending the funds as they should be spending them. And even then, those reasons are the ones that are supposed to be, be dealt with in a way that shows or that leads to having services actually being delivered on the ground. Because once money is taken back, we know that there are certain services that are going to obviously be affected. And as I'm putting it, I'm saying that across the board, you can't really choose what service is more important than another. And yes, even in a case where we're talking about ambulance services, we're talking about emergencies there, right? So that's pretty important. But at the same time, you've got many other services that are very, very critical, where we need funds in those service areas, and money should not be going back. So how they're going to prioritize within a thinning budget, really, it remains to be seen, because these are the kind of engagements that we try and have with departments such as the Department of Health in this province, where we're trying to, show in the research that we do on the ground, based on information that we collected from what we see from the actual official documents that they put out, that in general are put out by the state, as well as information that we collect from the interactions that we have with our clients or our communities that reach out to us when they need assistance when it comes to trying to access some of these services. There's that balance of trying to prioritize which area will need a clinic more than which area. There have been communities that we've been working with that have been fighting for, for clinics to be built in their areas, because they've shown time and time again, they've taken it upon themselves time and time again to go to the department and show that they are in dire need for clinics to be closer to where they stay, because where there's a guiding policy that says that clinics should, when one is traveling to a clinic, it shouldn't be more than 5 kilometers away from where people stay. But what we've seen in the Eastern Cape is that people travel long distances, especially again in the rural context, where they travel through bushes, they cross rivers, women who are pregnant crossing rivers, people traveling through bushes to try and get to the nearest clinic. And in some instances, again, in the communities that we work with and with clients that we've been working with, where they've just shared with us that, you know what, I'm an elderly person. I cannot cross the river anymore. I cannot go through bushes and walk long distances anymore. So you know what, I'm going to stay at home and until there's a mobile clinic service that can be provided that is consistent, that comes through to us and tries to meet us halfway, because we cannot travel to these very long or rather very far healthcare facilities for the most basic of these services. And then when in certain instances you find that even when they get to those facilities, unfortunately they met with a situation where some of their needs, or rather their health needs, are not met to their fullest because some medications are not available. So there's a stock out of certain medications time and time again. And so that that continues to put a dampener on the experiences that people have when they are trying to interact with the Department of Health at the most basic levels, which is in their communities, within their communities.
Thokozile, we appreciate your time. Thank you very much for coming on. She's with Section27, a field researcher there.
Thank you so much.
Thokozile Mtsolongo, outlining some of the challenges that department is facing in the province.